So again, welcome to Mental Health Wellness and the Rippling Effects of COVID-19. Again, this is a collaboration, CBERS with our Virginia Hospital and Healthcare Association partners, along with Virginia Department of Behavioral Health and Developmental Services. And so we'd like to welcome everyone here for today's webinar. So the target audience for today's webinar basically is anyone who has responded somehow to COVID-19, whether you were working COVID-19, you continue to do your job, you went back to work, you never stopped, you were frontline, you may have been in education, you may have been law enforcement, you may have been public health, you may even have been an educator or even a faith-based leader. You responded somehow to COVID, you were affected. So we took the consideration of developing this curriculum with you in mind. So you are joining today's webinar with folks from all types of disciplines. So we welcome you all for today's webinar. I would like to introduce our facilitators. As we get started, we have 3 facilitators for today's webinar. They come with a wealth of knowledge. We have Melissa Petty, Stephanie Waite, and Melissa Garcia. Melissa Petty is a licensed professional counselor. Melissa has been licensed by the Virginia Board of Counseling since 2015. She's a graduate with her master's in clinical psychology from Radford University in 2008. Melissa has worked in behavioral health, beginning with Mount Rogers Community Service Board from 2008 to 2021. And she started her opened up her practice in 2021. And she is also a Medical Reserve Corps volunteer out in Southwest. So we welcome Melissa Petty. Stephanie Waite is also one of, today's facilitators. She has worked as the Disaster Behavioral Health Coordinator at Department of Behavioral Health and Developmental Services since 2018. She has also, prior to that, worked in the program administration and service delivery in criminal justice programs since 2001. In her role, she works to ensure Virginians have access to disaster behavioral health services following emergencies that impact the Commonwealth. Stephanie has participated in disaster response in a behavioral health capacity following the Charlottesville civil unrest incident in 2017, Virginia Beach shooting in 2019, and then the COVID-19 public health emergency in 2020. So we welcome Stephanie as well. And finally, our last facilitator, and not in this order, is Melissa Garcia. And Melissa was appointed to the Director of Operations of Dominion Hospital in July of 2019. Prior to transitioning to this leadership role, Melissa held the position of Director of Social Work at Dominion Hospital and has been with HCA Healthcare since February 2015. Melissa is a licensed clinical social worker in the Commonwealth of Virginia and has helped bridge the clinical and operational components of healthcare to drive strategy and growth. So we'd like to welcome our 3 facilitators. And before we move on to our presentation, we just want to make sure that all of our objectives are met for this particular webinar. So at the end of the webinar, you as the participants will gain the knowledge of local behavioral health and resources. You will also have the ability and to be able to identify and define burnout, compassion, fatigue, trauma, and stress as it relates to COVID-19. And then you will become aware of some self-care strategies, techniques, and skills, and we will be using self-care assessments, exercise, and activities throughout this webinar this morning. So it is going to be some general information for everyone, but it will be very informative and interactive. So before we get started and turn it over to our facilitators, Dr. Param Jabari, our Chief Deputy Commissioner, left us a welcome. And so give me a second and we will be able to listen to the welcome from Dr. Jabari.
Welcome to the Virginia Department of Health Community-Based Emergency Response Seminar. We're very glad to have you here today as we begin to explore some of the challenges with COVID-19. Specifically, our topic this year is mental health wellness and the rippling effects of COVID-19. It has been a long 2 years here in the Virginia Department of Health, and along with our other partners across the nation, our first responders, our healthcare providers, our educators, faith-based leaders, community organizers, and outreach workers, we've been trying to serve the community, helping them to ensure that they're protected against COVID-19, helping respond to their healthcare needs, and all of the issues that surround this devastating impact of a global pandemic. We realized throughout these 2 years that many of us have worked nonstop, worked beyond our usual hours, worked on weekends, forgone the traditional vacations, either because of the pandemic or other restraints. And now many of us are feeling fatigued. Many of us are feeling tired. And one of the most important things to recognize that all of us are susceptible to burnout and compassion fatigue. And throughout this presentation, throughout our seminar today, we hope to be able to identify those terms, define them, and be able to provide you with some resources and how we can potentially address that mental health fatigue that we're all feeling, whether it's through self-care, through coping strategies. Throughout the seminar, we'll be showing you various resources that you can use, not only personally, but perhaps resources that you can also take back to your home organizations and to your communities to share further. It's really important that we seek help when we feel we need it. And this is important not only for our citizens and our residents, but also for all of us who have been responding to this, again, pandemic for well over 2 years. I want to thank our partners with the Virginia Department of Behavioral Health and Developmental Services, our colleagues at the Virginia Hospital and Healthcare Association, and certainly our staff at the Department of Health who have helped put this wonderful seminar together for us. I hope you find it useful and again are able to take this message back to your communities. Let me thank you again for your time and above all for your service to the Commonwealth and the residents of this wonderful state. Thank you.
Good morning, everyone. I'm Melissa Petty, and I'll be talking to you about stress this morning. So stress is what arises when something we care about is at stake, and no one is immune to stress. This includes mental health professionals like myself, healthcare workers, first responders, community organizers, volunteers, clergy members, teachers, and any other role that you might have in your life. So we all need to be checking in with ourselves either on a daily basis or on another timeline that meets your needs about where we are in our stress levels and what we can do to play a role in managing that. Next slide. So everyone experiences stress differently in their bodies, minds, and lives. And stress can manifest in physical symptoms on an ongoing basis, regardless of your situation. So it's really important to be paying attention to how your body feels, because the physical signs can often be the first signs of stress that we notice, because we might be pushing some of that stress outside of our minds, and our body has a way of getting our attention. So this might be like chest tightness, feeling like you can't breathe, headaches, difficulty sleeping, inability to relax or restlessness, heart palpitations, having some digestive issues. So it's really important to check in with both your mind and your body just to see where you're at and if you're carrying any stress. A lot of people will carry stress in their shoulders and in their neck and their back. So everyone is different. I've heard people even carry some stress in their legs or feet. So it's important to know yourself pretty well and check in with yourself. Next slide, please. We'll move on to how stress can manifest in our body or in our minds. So this can be feelings of fear, anger, sadness, irritability, feeling numb, fatigue or frustration. It could be changes in your sex drive or interest, kind of preoccupation with the event. Some people will say that it's all I can think about is the stressful event that might be happening. And especially with COVID, when it was first presented to us, a lot of us spent the first couple of months when we were on lockdown and lots of quarantines, like that was all we could think about was COVID. So it really affected our ability to concentrate and make good decisions. If for those people who had physical health problems before the pandemic, the stress may have made those conditions worse. And that includes for mental health conditions too. Some people noticed their mental health worsened throughout the pandemic. And also other people noticed that they used more tobacco or alcohol or substances. So it's really important to be aware of your use. If you're noticing the increased use, that's a sign that you are under more stress and you're trying to cope with what's happening. And maybe that's not going to work out in the long term because that tends to lead into substance use disorders. So we'll go to the next slide, please. We're just going to talk about first line responders in stress during COVID, and then we'll move on to other professions and community members. So first line responders often spend a lot of effort in controlling their feelings and hiding any stress reactions. So they can be really reluctant to ask for help. So in some circumstances, the distress can be managed successfully to reduce any associated negative health or behavioral health outcomes. But in other cases, some people might experience some clinically significant distress or impairment. So those people whose daily coping skills aren't working for them, they're noticing more distress, it's really not effective. That's the folks who really need to consider going to see a mental health professional to talk about what's going on. First responders are also susceptible to compassion fatigue and burnout, which Stephanie and Melissa Garcia are going to talk about in the upcoming slides. So that compassion fatigue and burnout, it can result because there's a chronic workplace stress and exposure to those traumatic events during COVID. So it's really important for us first responders, and for those of you who are first responders, to talk openly about how the pandemic has affected your work. If you are a first line responder, you may hear or see a lot of gory things, and you may need to talk about what you've experienced with someone who can understand it. It can be really easy to become cynical when you see and hear about some of the worst experiences that society has to offer. So in order to keep your joy in your life and keeping you grounded in who you are, it's really important to take inventory and check yourself when you are becoming really cynical, because that's a sign that you're really stressed and you're trying to cope with it the best you can, and you might need some extra support. So ask about how to access mental health resources in your workplace. Sometimes our emotional reactions don't really hit us immediately, so we don't really know it in the moment that we're really stressed or we need extra help or support. So know that it can take days or weeks to realize that something has impacted you, and it might even continue for several weeks longer, depending on the situation that you've experienced. With the pandemic, it seems like it was like little things stacked on top of each other until it became this really big thing and a really big stress. And it really affected our ability to cope, and our coping skills really weren't working as they were before. So it's important to look at the situation, look at how you're coping, and then decide if you need extra support in your life, whether that's through family members or friends or clergy members or a mental health professional or support groups. And then just remind yourself that everyone is in or has been in an unusual situation with limited resources at times during this pandemic. So you are not alone in this. We're all experiencing this collective trauma together in very different ways. Next slide, please. So we really want to look at how we can identify and work towards accepting the things that we don't have control over. That's a huge thing that the pandemic has really forced upon all of us. So there's a lot of things outside of our control, and we've really had to work towards accepting those things. We also have to recognize how we're performing a really crucial role in fighting the pandemic, and that we're all doing the best we can and with the resources we have available. The only way we really can increase our feelings of control and reduce feelings of powerlessness is focusing on what we do have control over, like our consistent daily routine. If we could keep it the same as before the pandemic, into the pandemic, then it's going to feel more safe to our brains. Because anytime there's a lot of chaos and unpredictability, that feels very unsafe to our brains. And so it can increase our stress levels. Next slide, please. It's really important to take breaks during your work. It doesn't have to be a long break. It can be 1 or 2 minutes. We'll be doing some breathing activities, so that way you can just get some quick ones that you can try anytime. A lot of these can also be done in front of other people, and they won't even know that you're doing a relaxation technique in the moment. It's also really important to spend some time away from work, getting exercise when you can, being outdoors, whether being physically active or just relaxing. Both things are great. And really focusing on doing things that you enjoy during your non-work hours. If you are finding yourself working during your non-work hours, then you might have to take some assessment of that and decide what you really need to meet your emotional needs and how to reduce your stress levels. Next slide, please. So I mentioned before, misusing alcohol or other drugs, including prescriptions. It's really important to ask for help. For women, it would be 3 or more drinks per week. And then for men, it's 4 or more drinks per week. It's really, that's when you're getting into some risky behaviors, and it could potentially turn into an alcohol use disorder. Or if you're using more of your prescribed medication than you had before, that's something to be talking with your doctor, especially with benzodiazepines. There's a huge addiction potential with those, or any opiates. There's a huge potential addiction for those. And so it's very important for you to be mindful about how much you're taking, and if you're making sure that you're following your medications as prescribed. And then if you're already in therapy, it's really important to continue and discuss any new or worsening symptoms. It really is important that we destigmatize therapy, because everyone can really benefit from therapy at some point over their lives. Next slide, please. So we'll move on to those who are not first responders. These would be teachers or clergy members, volunteers or community members. We have all increased work-related stress because of COVID at some point during the pandemic, and it might have been completely constant throughout the pandemic, but this stress might have been in the form of, concern about being exposed to the virus during our work, taking care of, our family members, our neighbors while we're working, really managing different workloads, different environments, and having new tools that we had to learn on the fly, having lack of access to tools and equipment that we needed at times to perform our jobs, or just really kind of working towards how do we feel safe while also being in the helping profession, because a lot of us are in the helping profession, whether that is a clergy member or a teacher. You're still helping someone by giving them resources or support or education. So we'll go to the next slide, please. A lot of those who are not first-line responders often felt like they weren't contributing enough during the pandemic, and could feel even feelings of guilt because of that, because they might have been used to being, right there for a neighbor, right there for their community, and all of a sudden we had COVID and we weren't able to do those same things that we did before. And that could produce a lot of feelings of guilt that we might still have today. I think we're getting in a much better place than Virginia currently, and we just still have some uncertainty ahead of us whether or not any new variant in the future is going to be a worse or put us back to 2020. And if that would be the case, we really all need to be cognizant of how that's going to affect us. And it might bring up a lot of the same feelings that we had during the 2020 to 2022. So uncertainty in the future, uncertainty in our workplaces, in our employment, in our volunteer, or in our churches, our communities, all of that is very stressful to ourselves and our brains, and we feel it both in our minds and our bodies. So we've had to really adapt and be flexible, and that is great up to a certain point, but sometimes we get that fatigue when that happens too often, too much, and over a long period of time like we've had. We'll go to the next slide. And just a note, just to say that if you've noticed these high levels of stress that have been triggered by the pandemic, then you might keep feeling this way after it has ended. And we'll go to the next slide and talk about different types of stress. So there's 4 different types of stress. The eustress is positive experiences. This might be funner and challenging in a helpful way. So getting married or having a child. It could be running a marathon or doing some other endurance sport. Like, those are really positive things, but they're challenging and can be hard at times. But they do place a stress on us that is a positive stress. And then there's acute stress. Acute stress appears just for a short period of time, and then it subsides when the stress is over. So this was something that we all experienced when we were in school and we had a deadline, or we were working towards the end of the school year like we are right now. We knew the stress was going to be over when school ended, and we'd have the summer off and we wouldn't have to worry about it. So acute stresses can be very time limited. And then episodic stress is something that happens more often and it accumulates over time. So this could be something like a recurrent argument in your relationship, or that kind of adds on together, or it could be, a difficulty with a coworker at work, or disagreements at work that kind of occurs more often or accumulates over time and adds stress to us. And then we have chronic stress, which arises out of serious life problems that are fundamentally beyond our control, like poverty, pandemics, war, racism. Yes, we can all play our small roles in our individual lives, but these are much bigger problems that place like a weight on us that we might not realize on a day-to-day basis. So what we'll do is we'll open the poll, Trini, if you don't mind, and just put in in the polling section what type of stress you have most in your daily life. And we'll just take a few short minutes to get that. And again, the U stress is positive stress, and the acute stress is time-limited stress, and episodic is something that is happening more often and accumulates over time. And then in chronic stress are the big things in life that we don't have a lot of control over. And it is the same as the other sessions. The most is the episodic stress, with acute stress and chronic stress coming in tied at second. So we'll go to the next slide, please, and really talk about the effects of not managing episodic and chronic stress. It can lead to depression or anxiety, and it's really worth mentioning that both depression and anxiety can be triggered by medical conditions. So it's always a really good idea to have your primary care physician or your medical provider complete an evaluation to rule any thyroid dysfunction or vitamin D deficiencies. Those things and other medical conditions can either trigger an onset of a depressive episode or anxiety, or they can exacerbate or make it worse. So we know that everyone has been through a lot, and it's really normal to feel stressed during this time. And it's also okay to seek mental health help. So that could be we want to make sure we're normalizing mental health treatment just as much as we normalize physical health treatments. So if you don't have a provider for your mental health, a lot of employment agencies have what's called an employee assistance program, or an EAP, which allows for 1 to 4 free counseling sessions with a therapist in network. You can also call the back of your insurance card for a referral to an in-network provider, or if you're uninsured or your insurance doesn't have mental health benefits, there are mental health professionals who have sliding scale fees or pro bono slots. Additionally, Virginia has community service boards to provide services for those who are underinsured or not insured. So I also want to just bring our attention to if you are having any thoughts about suicide, that does come with depression at times. It could also be in the form of just feeling like you don't want to live anymore because you're feeling under so much stress, or being really overwhelmed with emotions, or having feelings of hopelessness that things are never going to get any better. This is a mental health emergency once you're having those thoughts, and especially if you have a plan or intent to follow through with those thoughts. So it's really important that you have access to resources, and I'm going to put some of that information in the chat, and I'll do this again later on too, but it's also in the participants manual. But we really need to have a safety plan in place if you do have a history of depression or anxiety, of who you can call and who you can talk to about how you're feeling and what you're thinking. We really want to make sure that if you have a history of depression, that you have a plan to keep firearms and weapons away from you, and have a list of healthy activities that you enjoy. We really want to make sure that you keep yourself safe, because depression is really sneaky. It sneaks up on us and we don't even realize it. So it's important to have a plan that's preventative before we get to that point, so we can manage it early rather than waiting until we're feeling much, much worse. And we have to have a mental health emergency, or be seen by crisis services through the community services boards, or even have a hospitalization or a crisis stabilization visit. So it's really important to know that the more you talk to people, the more you have a talk with your therapist or other medical provider, that that connectedness acts as a buffer against hopelessness. So feeling connected to others reduces our psychological pain. So you really have to know who you can reach out to in advance, because it gives you that safety net if you experience any depression or thoughts about suicide. So again, we've put a lot of great resources in the participants manual, so please reach out to them. And that National Suicide Prevention Lifeline is really helpful. A lot of studies have shown that they significantly reduce the feelings of depression. People leave those calls feeling less suicidal, less overwhelmed, and more hopeful at the end of those calls. And a lot of times they will connect you with a provider to get ongoing support afterwards. Next slide, please. Managing stress, so ways that you can manage stress. It's really learning how to cope with stress in a healthy way that will make you, the people you care about, and those around you become more resilient. So we're going to review ways to manage stress. So please know that some of these tools are going to work for you and some of them aren't. It's really important to have a wide variety of tools in your toolbox so you can try new skills and have those skills that work for you, but also be open to trying something that might work sometimes, or it might not work at other times. But it's good to have a good full tools of toolboxes, just like we would if we were repairing a house. We don't want all hammers. That's not going to do the job for everything. We need to have a variety of tools for anything that we do. So next slide, please. We'll talk about stress management ideas, especially related to the work and volunteering, making sure your workspace is tidy, having a ritual to end your day, having weekly traditions with your family or friends, learning how to practice self-compassionate self-talk and being kind to yourself and treating yourself like you would your best friend, getting regular exercise, and really consider how much exposure you want to have to the news, especially if you're seeing a lot of stressful things or you're hearing a lot of stressful things. Sometimes the news might be too overwhelming for you, and you might have to consider just reading the news via like an email newsletter or a print paper just once a day so you're not overwhelmed. And next we'll go into a mindfulness activity. So we're just going to do a very brief mindfulness activity right now. And what you'll want to do is you're going to get in a very comfortable position. And hopefully most of you are already sitting really comfortably in your homes, or maybe you're at the office on the weekend. Really take a moment to feel rooted and safe and comfortable in the seat that you're sitting in. And if for some reason you're not sitting down, if you could just take a moment to take a seat. We're not going to take this very long. It's just a short, quick thing that you can do to check in with yourself. And once you're settled, I want you to close your eyes if you feel comfortable doing so. You can leave them open and just look at the tip of your nose if you don't feel comfortable. And then I always like to put my hand on my chest just to kind of monitor my breathing. And take one deep breath in through your nose. And then we're going to breathe out through our mouth. And what we'll do is we're going to inhale for a count of 4, and then we'll exhale for a count of 8. So breathe in, 1, 2, 3, 4, and then exhale, 1, 2, 3, 4, 5, 6, 7, 8. And we're going to keep breathing at this nice slow pace. And when you're inhaling on the count of 4, I want you to imagine that you're breathing in any peace and calmness and strength that you need. And then as you exhale, I want you to imagine breathing out all of the anxiety and stress and worry. There's nothing for you to worry about right now in this present moment. All there is to do in this moment is breathe. And as you breathe, feel that anxiety slip away with every exhale that you take. And if your mind drifts to any feelings of worry, just be mindful and notice it. You don't have to judge it. Just bring your attention right back to your breath. And remind yourself that you're strong and you can handle anything that life throws at you. Take these final moments just to notice how calm you feel as you sit and breathe. And then when you're ready, you can open your eyes and take this feeling with you. So we'll go to the next slide and we're going to do a quick check-in. In the chat box, I would like you to share what your current self-care routine is. So what are those tools that you're using on a regular basis? And if you don't have a lot of them, if you've maybe been neglecting this over the course of the pandemic, put some ideas in there about something that you would want to try or that you used to find a lot of joy or comfort or relaxation in. And what we can do from this is once we get that nice long list in the chat box, we can write these things down, and if they might be new ideas from other people, they could be things that we forgot about that we did enjoy. A lot of times people do forget about the things that they really enjoy over time when they're busy and stressed. So bringing our attention back to the things that we really, really enjoy or gives us just that sense of comfort or relaxation. And a lot of times people do feel that reading or doing something calming, going out with others, spending time with healthy people, being outdoors. A lot of great ideas in the chat. You can keep putting those in, and I'm going to move on to the next slide and talk about more self-care, which is really recognizing what's inside of our control. We talked about this a little bit earlier. We really want to know that the things in our control, we do have the power to make decisions about, whether it's focusing on what's important and in prioritizing those things, setting reminders to help you to like really consciously remember what's inside of your control is fine. It's great to use the technology that we have with our cell phones and computers to put those reminders and take that mental load off of our brain. We can focus on what's important. We can focus on our routines. We can focus on what boundaries that we want to set for ourselves and for others, focusing on eating well and exercising, how you seek and offer support, and whether you're participating in voting or activism. All of those things and more under your control. Now, not everything is going to be completely in your control or completely outside of your control. A lot of times there's a mix. It's like a percentage, really. Some things are going to be majority in your control, but there's going to be some aspects of it that aren't in your control, where wrenches kind of get thrown in our plans and we have to be flexible and adaptable, but also be mindful that we can set boundaries and say no if we need to. Go to the next slide and talk about what's outside of our control, which is, other people's decisions. That was a huge thing with this pandemic, that we really realized that there were a lot of decisions that other people were making that maybe we didn't agree with, and that was outside of our control. And we had to really learn how to let go of that need for control and wanting people to do what we were doing, and trying to convince people to do the things that we were doing. It was all those things are outside of our control, and it was adding to our stress, focusing on those things or trying to change people's opinions. And despite all the great information that we had, it was really difficult. So all of those things are outside of our control, and we have to be mindful and really say, like, how much attention am I going to put on this if I really can't do anything about it? Or if I feel like the majority of the things I can't do about it, what is the small percentage that might be in my control that I would have influence on? And in the next slide, we're going to talk more about community care. So we talked about a lot of self-care, but there's also this concept of community care where we're giving or receiving care from others. And this can look in a different variety of ways, like babysitting, bringing meals, random acts of kindness, donating, addressing conflicts, speaking up, participating in support groups. There's a lot of different ways that we have received community care before the pandemic, and the pandemic did throw a wrench in that as well. And so we might have to go back and kind of remember, what did we do before the pandemic to show other people that we cared, that also brought us a sense of joy or satisfaction with our lives, or just giving back, because giving back feels really good too. So in the next slide, we're going to have you do the same thing that we did with our self-care. We'll put in the chat box what ways you give community care to others and how you would like to receive community care from others. So we can use these ideas again to make another list of activities, how we give and receive joy, comfort, connection, and relaxation. It's really important that we both give and receive. If we don't have that, if we're not receiving or we're not letting people give to us, we're really withholding joy from others. So instead of feeling that we should feel guilty, or we never need any help, or that we can always do it on ourselves, or we're always the caretakers or always the givers, if you can maybe change and reframe how you think of that, that by not accepting help from others is really withholding joy from others, because they get joy from giving to us too. So it's really important that we're looking at how much we're giving and how much receiving to make sure that we're keeping that balance and not denying ourselves being cared for by others. So I really love the ideas in the chat box. Please continue to put those in the chat box as we move along to the next slide, where Stephanie is going to be talking about burnout.
Thank you, Melissa. Thank you for that information. So good morning, everybody. My name is Stephanie Waite. I'm the Disaster Behavioral Health Coordinator with the Virginia Department of Behavioral Health and Developmental Services. We are going to sort of take Melissa's presentation a step forward and talk about burnout. We'll spend a little bit of time defining what it is and how that definition may have changed as a result of the pandemic for you. And then we're going to talk about some of the symptoms and what we can do to address burnout. Next slide, please. So the coping strategies that Melissa just mentioned and the things that you all put in the chat. So burnout is what happens when we don't have the energy to do those things, and they're not really making us feel any better. So our coping strategies are no longer working. People may feel hopeless or feel like they're at a dead end in their lives, and they really don't feel much of anything at all. Activities or hobbies that used to bring them joy with family or friends, they tend to disconnect from. In cases of work burnout, which is what we're essentially talking about for the most part here, prior to COVID, and burnout has always been due to the policies and the practices within an organization that make people's jobs more stressful and anxiety producing than they need to be. Things like workplace bullies, micromanagers. And when we talk about burnout during and post-COVID, you know, a lot of people have been working for long hours, long days, and long periods of time without taking time off, simply because the agency is understaffed. Another example is when people feel like the work that they're doing is in vain, and they lose hope that their jobs are worth doing at all. Next slide, please. So let's have a look at the stressometer. Melissa Garcia, who is our next presenter, is going to talk to you a little bit more about this. But if you could, we're going to take another poll, Adriana, if you would bring that up. So looking at the graphic on this slide, and we can just assume that green is normal and controlled stress, and let's say red is burnout based on what we know so far. If you could put in the poll, indicate where you think you are, say, today on the stressometer. So green, yellow, orange, or red. So again, assuming that green is bright sunshine day, all is well, and red is burnout. And we know that this meter can be different for us week to week, day to day, and sometimes through the hours, especially if you work in an environment where stress can be very sudden. The onset could be very sudden of something that you have to do. A lot of people experience that. during COVID. Looks like 39% of you are yellow, which is pretty good. Our last group was in this same range. That's really good news. If we were doing this last year, 18 months ago, I could assume that perhaps it would be different, but it looks like most people are in the yellow to orange area today. So glad everybody's feeling all right. Next slide, please. So some of the symptoms of burnout, you know, and they affect people in different ways. And Melissa talked a little bit about that. When people experience prolonged periods of stress or being overworked, feeling overtaxed between their duties at work and at home, they feel anxiety and general disconnect. Their body responds in physiological ways. So people may feel tired, exhausted all the time, but have difficulty getting to sleep, staying asleep. And especially during the height of the pandemic, people became sick more often because, you know, stress, anxiety, and burnout lowered their immunity. And we know that lowered immunity was a risk factor for contracting COVID as well. So while these symptoms, you know, these are the most recognizable, and you may think that, oh, I recognize these symptoms in myself, I'm very self-aware. Like Melissa said, they do creep up on you. So it could be sometimes there's a disconnect between you think things are going okay and then your body's acting this way. Those are things to kind of look out for. Next slide, please. And a lot of attention has been paid to how members of the healthcare industry have been affected by COVID, but it's important to note here that everybody has been affected by COVID. The very nature of COVID early on, there was no vaccine. We were all in isolation. We didn't know really what was going on. And those who had a responsibility in or out of the healthcare industry to care for people, people that worked in EMS, people generally felt disconnected. I know my neighbors who are elderly, for example, they couldn't see their church family for months and months on end. And the technology, their church eventually got up online on Sundays, and they needed some help with, you know, how to get that up. They don't have a smartphone, so how do we get that up on the TV? So that was something that they needed help with. But their church family, you know, really is their family and their dearest friends. And that was really difficult for them. But, you know, so please know that if you don't necessarily work in the healthcare industry, you're still a caregiver. So if you work in education, human services, or public safety, you are a caregiver. You are assisting the community and interfacing with them every day. If a member of your household has a disability or has health issues, or perhaps you live with an elderly member of your family, you are certainly a caregiver. If you're a member of the church clergy, you are a caregiver. So we all have various responsibilities to juggle between home, work, family, community, and so on. So everybody has been affected by burnout over the last 2 years because of the pandemic. It's important to note that while we are no longer in the height of the pandemic, people in the last few months we're starting to see that people are still feeling very anxious, stressed, even depressed, and burnout. So maybe while the circumstances have changed a little bit for the better, again, our bodies, that body-mind connect. Sometimes it takes longer for our bodies to get that message, and they don't just snap out of it like we wish they would sometimes. So it takes a little bit, more than the situation changing for us to sort of feel like ourselves again. And it's really important to have a support system. So, for example, if you're somebody that journals, you could, write down so that you remember, and, sort of make a promise to yourself that who, say, 3 people are in your life that you could go to about anything, that you won't feel judged, that you can talk to about maybe some of these, symptoms that you're experiencing and you're unsure as to why. Next slide, please. So burnout risk factors, this is something that we've known about for a long time, really regardless of where you work and what you do. Extreme workloads actually refers to having too much or too little to do. And this could even mean going through long periods of time where you have too much to do and then suddenly that stops. And so, like we said, our body's still going at that rate, but then it stops. And we feel sort of dysregulated. And it could also mean having too little to do. Let's say things were maybe even, or, work wasn't all that exciting before the pandemic. And then all of a sudden you're working all the time and things need to be done by yesterday. That can be stress inducing as well. Schedule, employers or your job makes it very difficult to have flexibility and maybe little to no understanding of the necessity for balancing home and work. I know a lot of people were having difficulty with childcare, in addition to the fact that while they were working from home, for example, or they had to keep working, somebody had to be at home to have school online with kids. Unclear expectations. A lot of people experience frustration and anxiety because they don't feel like they've been given enough information about what the outcomes of their work should be. And it can be especially difficult if you work for people that show disapproval or condemnation of the outcomes of your work. Everybody had to take on new roles during the pandemic. Many employees decided to go ahead and retire as a result of that, or they quit because they felt that the stress and anxiety simply, was not worth the work that they were doing. Some agencies have taken a financial loss by reducing the number of business hours and because of their ability to connect with consumers face to face. And so as time passed on, the employees that did stay on found themselves in new roles with more to do and the job expectations having dramatically changed. And some examples of that could be, people feel that they are being asked to do things that they've not done before, they're not trained to do, and that can really be frustrating. So think about some of the things you may have had to do over the last 2 years that you felt completely unprepared to do. And like I said, one thing that stands out that I've talked to a lot of parents about is all of a sudden being a teacher. That can be very difficult. So toxic work environment is, one of those things that's always been associated with burnout. I mentioned workplace bullies, somebody that just feels like they pick, micromanagers. But as the pandemic has worn on, and now that we're in this sort of new phase of getting back to normal, a lot of people are heading back to the office for the first time in a while. But a lot of companies have also opted to keep some degree of their employees working from home. It's perhaps some hybrid schedule. It's caused a lot of problems within agencies, a lot of things that supervisors and human resource departments really need to consider. All along, there has been a lot of political lines and personal belief lines and boundaries drawn between getting vaccines or not getting vaccines, and what does that mean about going back to work, wearing masks or not wearing masks. And then you have some people within the same organization who continue to go to the job site all throughout, while others were able to do their jobs from home. And this can certainly cause a rub and have people feeling disgruntled. And it kind of feels like a scenario where maybe there's, the haves and the have-nots, people that, have opted to continue to wear masks and don't necessarily agree with the agency policies. They may feel that they are, the managers may come across as if they are difficult employees. Employees are made to feel that way. So a toxic work environment means a lot of different new things in light of COVID. Next slide, please. Seeking help is definitely suggested and an important part for addressing burnout. When it comes to burnout, it is absolutely imperative because people generally feel hopeless and stuck. People that are experiencing burnout don't have a difficult time motivating to do those activities that they've enjoyed doing before. But when you think about all the symptoms of burnout, we talked about how sometimes the mind can feel very disconnected from what your body's telling you. A good place to start is with the symptoms to your general practitioner. Even if you don't recognize what you're feeling, even though the symptoms look like those that we've been talking about, you perhaps may not recognize that as a mental health issue. Talking to your doctor, your general practitioner, and this is maybe somebody that you've known for a while, about the symptoms can be very helpful. One personal example is that last summer, sort of at the height, 2 summers ago, at the height of the pandemic, I noticed that when I went to sleep at night, my heart was beating really fast, and I noticed that during the day, I was having difficulty breathing. I've always had asthma, and so I was using my inhaler more. I didn't know why, of course, like everybody else, I thought, well, maybe I have COVID. So I decided to call my doctor, and we had a virtual appointment, and I told her about the symptoms, and she asked about, how much busier, what kinds of things are you doing with work? And I was very busy. It was a disaster, and there were things I had to address. And she came to the conclusion that I was experiencing panic. And it really goes to that mind-body connect, because I felt like a person that was very organized, very aware, and I was handling my stress in this, way that I've been taught and that I knew, and panic is new to me. And so I came up with new ways to address that and sort of got used to this new way of being. So that's an example of how working with your regular doctor can be really helpful. Next slide, please. Mitigating burnout. Melissa mentioned this, and I'm not going to spend too much time on it, but there are things that we could, or habits that we may have picked up, or things that we've always needed to do but felt we needed more of, such as maybe having an extra glass of wine at night to calm down. Many people were getting less sleep because they needed to work more, so they may have been prescribed sleep medication by their doctors because they didn't have enough time to really wind down, like a lot of us need to do in order to get into that space to get good sleep. And that can become habit forming, and the more you need to take, probably the more groggy you feel the next day. And it may not be something that you realize. Doctors also prescribed medications such as Xanax, pain medication. Stress can manifest in a lot of ways. Melissa mentioned body aches. So people needed to get something to sort of get them back in gear so that they could work and be functional. But now that the pandemic has changed and perhaps things are slowing down in the work realm of life, we realized, uh-oh, I'm still taking these medications and I don't feel well. I don't feel like myself if I don't take them. And I just want to note that it's not an error of morality. Most substances that become problematic, as we all have become aware, they were legally prescribed by a doctor and they are fine to use. But when we feel that life becomes chaotic and people aren't doing the things that usually make them happy, using medication can feel like a fast and easy fix because of what life has thrown at you. And a lot of people still feel like they rely on these things to regulate their mood. So it's something to consider, it's something to think about, perhaps in loved ones or people you see on a regular basis in the community. Next slide, please. So I'm just going to go over a brief scenario and just sort of get your thoughts about this. This is about somebody that works in the education field. So we'll go through this and then I'll just ask a couple questions and you can just put down in the chat what you think. We see that Heather is a preschool teacher and her school has decided that masking policies are opt-in and she's chosen to continue to wear a mask. Her students struggle to keep their hands off their faces in masks and several do not wear them. So she sanitizes her classroom and provides hand sanitizers regularly throughout the day. Many of her colleagues have left and her classroom has additional students. Heather begins to experience compulsive cleaning behaviors and she has difficulty sleeping at night. So what do you think are some of the things in this scenario that might be under Heather's control? So you can just make comments in the chat there. What are some of the things in this scenario that she can control? Maybe should sort of spend more time exploring. Melissa talked about the importance of recognizing the things that we are and are not in control. And, you know, one of the main things about burnout is people feel that they no longer have control of their schedule and their lives, and they sort of come to this dead end. And it's important to recognize the things that we can change in our lives. And what about the things that she may not be able to control? Certainly the policies at her school may not be under her control. I see send a reminder to parents about the importance of the mask. She can control wearing her own mask and creating a nightly routine to assist stress reduction. Absolutely. So maybe there are some, she has, you know, changed the way that she prepares for bed at night. Maybe do some of those breathing exercises. I know that for me, in the experience I just shared with you, one of the things I did is used an app called Aura, and it walks you through meditation, but it also has really relaxing noises and sounds like rain and the ocean. And they also have meditations on there that sort of guide you into sleep. I see Calm is great. I tried that too. Except that some of the students may become infected. Absolutely. So that's great. Thank you for Liquid Mind CDs. Awesome. Thank you for that feedback. So what we're going to do now is listen to the experience of a caregiver who was responsible for providing support to people that were having trouble coping with the effects of COVID. And I'll turn it over to Adrenia so we can watch that.
I'm exhausted. I find that I work so hard to keep my eyes open, stay present, stay compassionate. But all day, I'm on the phone with individuals that are having maybe the worst day of their lives, and I care for them, and I make sure that their needs are listened to, that they're validated, and that they are connected to the resources that they are close to. But what about me? When I come home, I don't necessarily have that same support. I'm grouchy because I'm tired. I've just spent all day caring for other people, and I might yell at my partner. I might not want to eat healthy. I might go grab dinner, or sometimes even skip meals altogether, because who has the time to think about food and my needs when I take care of people all day? Sometimes that sends me into thinking that I'm not good enough, that this is not the field I should be in because I don't have the emotional strength to be happy all the time. I wonder if I can keep this up forever, if I'm really doing what's best for myself and my family. But I also know at the end of the day that I'm helping individuals that need help, and that still feels good. Working from home has been a challenge. I also sometimes feel that there isn't a break in the day, that I have kids running around at my feet and dogs that need to go outside, and there's always somebody that needs something. And I hope that I have the capacity to meet all of their needs, but am I really meeting my own? Self-care and bubble baths don't always do the trick. Sometimes it's more than that. Sometimes I need quiet and a book and time and space and the ability to talk to my friends. My friends are also it's been challenging, hopefully closer to an end.
All right, I will turn it over to Melissa Garcia. She will talk to us about compassion, fatigue, and resilience. Thank you.
Hi, good morning, everyone. We sure have had a great session as we've explored the impact of stress and burnout. And today I'm going to be talking and building upon those tenets as we talk about compassion, fatigue, and resilience, and helping the helpers, which are each of us. And so moving on to the next slide, we're going to start with a brief video and then go ahead and get started.
Whoa, that's not good.
Oh, I don't need this. I'm already late.
Somebody will come. Anybody out there?
Do you have a phone?
No. Sorry. Somebody! Hello? There are 2 people stuck on an escalator and we need help. Now, would somebody please do something?
Help!
I don't believe this. You gotta be kidding me.
I'm gonna cry.
Well, there's not enough left to do, is it?
Hello? Hey, don't worry about it. I'll fix it in a second.
He said he can fix it. All right. All right. That's more like it. He says he can fix it.
All right. So I wanted to take a moment, and if you have the moment to share in the chat box, have you ever felt stuck? Have stress and burnout ever built up where you weren't able to see the outlet of being able to get out of the situation, or not being able to see an end or problem solve when we're going through these times? What I like about this video and this quick YouTube, and we'll definitely make sure that this is available to after the presentation today, we'll make sure that everyone gets the link to this. But sometimes we can't see that we can get off, or we're so consumed with stress and burnout or compassion fatigue, which we're going to be highlighting shortly, that we aren't able to see that we can navigate or get out of that space to be able to take care of ourselves and build that resilience to be able to navigate life. And so we can go on to the next slide, and we're going to build upon how to get off the escalator of life, and we'll definitely share this video afterwards. So today I'm going to talk a little bit about the professional quality of life and how we build that. We've talked about stress, we've talked about burnout, and today I'm going to highlight what compassion satisfaction is professionally and what compassion fatigue is professionally. And compassion satisfaction are those positive aspects of helping others. Those protect against compassion fatigue. When we start seeing the onset of compassion fatigue, that's where we start seeing the negative aspects of helping others. And then compassion fatigue breaks down into that burnout and secondary trauma. So we can go on to the next slide. I want to talk a little bit about compassion fatigue and the antecedents of compassion fatigue. And so we've seen through members of the community, faith-based leaders and communities of worship and our education services, that there's varying perceptions of mental health and confronting stigma and fatigue. We've also seen how faith-based leaders and educators are influential into how community members respond to fatigue, and they're often the primary mental health counselors for tens and millions of Americans in our community today. So the antecedents of fatigue are that if you're in a healthcare setting, those are those nursing shortages or shift work. If you are in a faith-based leadership role, this is where you may be seeing increased members of the community wanting to tap into your resources, and that you are fulfilled with that, but they start increasing into significant impacts of stress, or you might have too many community members that need the help and you're not able to provide that. Other antecedents of fatigue, you're going to start seeing that sleep depression that we highlighted earlier, and those increased demands from either patients, families, or community members. When fatigue starts to set in, that's where you're going to start feeling that interference with cognitive ability. So when we saw that video where they were stuck on the escalator, they weren't able to see a way to get out. When fatigue starts getting in, that can be a sustained sense of exhaustion, inability to problem solve. We might start having subjective feelings of tiredness, and that can impact our mental health. Where we start seeing consequences of fatigue, that's in a healthcare setting. You might be seeing patient safety, medication errors, or poor decision making. In other settings, you might start seeing a shorter fuse for the consequences of fatigue when people are coming to you as a helper of either a faith-based community, an education setting. You might start to have a shorter fuse by saying, oh, great, we have another community member that needs help. And where that if you had that compassion satisfaction, it would be part of your natural role. And consequences of fatigue lead into burnout, which we highlighted. And we're after this component, we're going to be talking about trauma. Next slide. So when do I need help? Because being highlighted in the chat right now, having compassion for ourselves is so important. And so we are going to be talking about how we can monitor that compassion satisfaction and reduce the impact of compassion fatigue and build in that resilience we're going to be talking about. So when do I need help? A little bit ago, we filled out the stress-o-meter poll, and we had a significant amount of people that were in that yellow and orange category. So I'm going to break down some of those the components right now. So when we're thriving and we're in that green, that's where you're in a calm and steady with minor mood fluctuations, or what we want to call healthy mood fluctuations, or responding to stressful or happy events appropriately. We might be able to take things in stride. We're able to accept that feedback. We're able to focus, and normal sleep patterns and appetite are with that. When we start surviving, or something isn't right, or our stress begins to build up, you're going to see components of nervousness, sadness, and increased mood fluctuations. You're going to be more easily overwhelmed or irritated. You might start having trouble sleeping or eating. And so when we think about our circadian rhythms affecting work performance, if we're not sleeping and getting into that REM sleep, we're not able to get into our fully functioning work mode to be able to concentrate. And work tasks that might take 30 minutes could take even an hour or two, because you're spending so much time trying to process all of the information that's coming at you and coordinating that. Activities and relationships you used to enjoy might seem less interesting, or you may even start to avoid them. And we've talked about the physical toll of muscle tension, low energy, and headaches. When we're struggling and you can't keep up, this is where you're going to start seeing exhaustion, that poor work performance, difficulty making decisions, restless and disturbed sleep, and that might be sleep onset. You're not able to turn your brain off. You might begin to self-medicate, and all of that impacts our work performance or our professional quality of life. And in the crisis stage, in that red stage, if you as a member of a leadership, professional leader in your community, that's where you want to also keep an eye out for team members. We're going to be talking about that. But if you yourself feel like you're in that red category, that is panic attacks. That could be nightmares or flashbacks. We talked about resources in the participant manual to help navigate you to the appropriate resource. And when in doubt, you can also call the National Suicide Hotline, who will help you navigate the resources, or the community service board within your locality. You might start making careless mistakes or an inability to focus. Some of the comments that we've seen come in today regarding also being a parent, you might be coming home from work and having parents or helpers too, and coming in and making sure that you are able to regulate your stress from your professional setting and regulate that at home. And you might start seeing withdrawal from relationships when you're in that crisis mode. Next slide. So what can supervisors and managers do? And that's how we can build a good support team for not only those we work with professionally, but in our community. You can translate a lot of this into your personal life as well. But this is what supervisors and managers can do in a professional setting. When you're leading people, or you're a leader of a shift for emergency preparedness, school, a faith-based leader, or a healthcare worker, this is where you want to foster the relationship with the employees you work with, or staff, or community members. You want to encourage healthy communication. You're going to want to model self-care, making sure you're taking those lunch breaks or those walks. And Melissa Petty highlighted different ways to build that into your schedule to reduce your stress level. You also want to provide mental health resources to your team. And today we're going to be sharing a lot of different mental health resources that you can build in to your toolbox. And also you want to manage people's performance. When you start getting into that intervention mode is where you might start seeing team members or community members having behavior changes. You want to make sure with those individuals that you're maintaining connection. You might begin to provide accommodations. Maybe they need a mental health day, and incorporating them into the importance that mental health is health, and that a mental health or a self-care day is needed. You want to provide the appropriate support and help manage their performance. When we think of, when we start seeing individuals that are either post-intervention or in that ill stage, that's where we want to follow expert advice. If you're seeing a team member that you are directly supervising, or that you have a leadership capacity over, you want to make sure that you're consulting with a group of individuals that can help support that individual and involving your mental health resources that you provide to your team members. You want to be patient. This might be a quick onset, or this could be an onset that develops over time. Next slide. So the professional quality of life scale fits into the tool for a self-assessment for all professionals on measuring compassion satisfaction and compassion fatigue. And if you go into your participant manual right now, or take a moment to review the manual, you'll be able to see that there is an activity link to be able to complete the professional quality of life scale. Anyone can complete this, whether you're a public health worker, a faith-based leader, an educator in the healthcare field, or a helper. If you are in a professional capacity, this is you rating your professional quality of life within the last 30 days. After you go ahead and complete this professional quality of life scale, then you can it will give you a rating of how you rate between compassion satisfaction, compassion fatigue, or if you truly are in burnout, and different ways that you can address that either within yourself or as a team. Being a clinical social worker in a healthcare setting, I've always had people that I've supervised and my team members complete this on an annual basis. I've also had members of my church that I've shared this with and our faith-based leaders to be able to share this and have them rate that for those volunteers that are in leadership capacities serving the community in a faith-based leadership role, to make sure that they're able to manage their professional quality of life with all of their other personal commitments. So definitely make sure that if you have a moment right now, you can pull out your calendar. I would challenge you to schedule this professional quality of life scale to be completed within the next week. And if you have time after today's setting and you want to complete that now, I think today is the best time to do it. We all know in a helper world that to-do list and those tasks continue to build up. So I want to make sure that you please schedule a time to do that. Next slide. So when we think of helping the helpers, there is a great resource that's provided by Give an Hour. Give an Hour is where licensed clinicians can provide pro bono resources for individual and family therapy or resource management. And they've created how mental health providers can cope with anxiety from the pandemic. This is an excellent resource. I know we're going to be highlighting our community service board resources that we've highlighted in our participant manual, but how to access those resources. And when we think of different ways that we can help the helpers, this is going to help us with our resilience and being able to cope with any anxiety that we may have. Next slide. So I want to talk for a moment about making space for joy without guilt. There were some comments that have come up in our last couple sessions, including today, is, how do I make that space? I feel like I'm taking care of all of my personal responsibilities. I'm a parent, I'm a faith-based leader, I'm a volunteer. How do I make space for joy without guilt? And the biggest components of that are time management and the ability to start asking for and accepting help. And I also wanted to share, I know that we have been able to highlight Calm, Liquid Minds, a couple other apps in the chat throughout today's session, but I also wanted to share additional self-care tools and apps to promote better rest and mindfulness to share with you today. These are also located in the participant manual. Headspace is a website that provides those helpful tips on meditation, sleep, stress management, and mindfulness. We also have the Calm app that answers a short series of questions on that Calm app that helps develop a personalized program for you. We did highlight the impact of circadian rhythms being compromised if we don't have good sleep quality. This is a great tool to help improve that REM sleep so that you can perform at your best. Hashtag self-care is a free artificial intelligence companion that's designed to promote joy and self-connection. It's not the traditional gamer app, but it's more, they said it's more like having a friend inside a phone. So when you need to look at something to help remind you of how to promote that joy. It's a great series to continue to monitor. Sleep School is an app and video clinic that offers that drug-free, evidence-based tool to help individuals and businesses sleep better and then also become more productive. And so that Sleep School is going to help those that want to focus on enhancing their circadian rhythm for their sleep. That's going to be a great component to focus on. So how do we practice resiliency and flexibility at home? At times, it's common knowledge that especially among providers that are eating well, exercising well, that's a balance for personal well-being that translates into our professional setting. This also helps provide advice. We can give this advice to our patients. We can give this advice to our community members. We can get our parishioners. We can give this advice to our students in our school to help them navigate that. We can go on to the next slide. So what are some self-care plan ideas? We've had an opportunity, but I want to open up the chat just for those that want to share some of their self-care plan ideas. I like to break down self-care plan ideas into components. The at-work self-care plan ideas, your physical care self-plan ideas, your emotional coping self-care plan, and then whatever gives you joy. So one example at work that one might be able to do is just take a break or that deep breath exercise. For physical care, you might want to stay hydrated. Probably all those in a helper capacity do not drink enough water. And we're constantly trying not to drink water so we don't have to run to the bathroom because we might be able to just help one more person. So staying hydrated and drinking water and building that into your self-care. That emotional coping is going to be maybe a gratitude list. And then whatever gives you joy. Do you have a home project? It's April. Have you planted your flowers yet? Have you played with your kids lately? If that brings you joy, if that brings you stress, have you painted with a friend or a team and just getting outside? I see some people taking a lunch break and going outside. These are great. Next slide. So what are some tips to improve resilience as you're coming up with your toolbox? You want to make sure that we can build connections and prioritize relationships. You might want to consider joining a support group or a book club. You want to learn from your own experience, remaining hopeful and being able to accept that change. We talked a little bit about practicing mindfulness, and part of preventing that burnout is avoiding those negative outlets. We want to also embrace those healthy thoughts and keep things in perspective. We do not want to get stuck on the escalator. And so when we're keeping things in perspective and we're on that escalator, and sometimes we can't think about a way to get off, we need to embrace those healthy thoughts so we can get off the escalator and make every day meaningful. So thank you so much for participating in this component. We're going to be talking about another facet that we wanted to cover today with Melissa Petty is going to be talking about trauma. Thank you.
Thank you so much, Melissa and Stephanie. You guys did a wonderful job talking about burnout and compassion fatigue. So we're going to start with trauma, just kind of in the chat box. Share what you think the percentage of adults in the U.S. who've experienced childhood trauma. So what would be your guess? How many adults in a percentage, like what would you say, how many have experienced childhood trauma when they were growing up? And so we're seeing responses from 30% to 75 to 80%. And if you've been in a trauma-informed care training, you know that our data prior to the pandemic has been that it's around 70% of adults in the United States have been exposed to childhood trauma. It'll be interesting to see what the results are in the next 18 years based on the pandemic that we've all experienced. So kind of keep that chat box open. I want to know what percentage of adults do you believe have been diagnosed with post-traumatic stress disorder? And this is also pre-pandemic data. So how many people do you feel like, what's the percentage, have PTSD? I'm seeing variations between 10 and 40%. It's actually that, and this is based on data from 2005, that the lifetime prevalence of PTSD among men is 3.6%, and among women is 9.7%. So again, it's going to be really interesting to see what the lifetime prevalence of PTSD is in the next 20 years, getting that data of how this all is going to be affecting us. It will be very interesting. We'll go to the next slide, and we're going to define what trauma is. If you can remember that trauma is essentially the 3 E's. It is a series of events, or one event or a set of circumstances that's experienced physically or emotionally as harmful or life-threatening, and has lasting adverse effects on the individual's functioning, whether that's their mental, physical, emotional, or spiritual well-being too. So it's an event that's experienced as harmful, and it has lasting effects. So that broad definition really allows the individual to decide what was traumatic for them. We'll go to the next slide and just talk about what we had considered traumatic prior to the pandemic. That's, community violence, discrimination, racism, historical trauma, natural disasters, motor vehicle accidents, having a loved one or a caregiver with a substance use or a mental health challenge, bullying or terrorism, refugee trauma, traumatic grief, which is includes being a survivor of someone who has died of either an overdose or suicide. That can be a very traumatic experience, or it might even not have been related to an overdose for suicide. It may have been another sudden, very abrupt loss that we didn't see coming, can result in traumatic grief and be very difficult for us to move past or move on with that loss. So the next slide that Ardrina has pulled up is what some of the traumas that we've experienced during this pandemic, and some of the traumas that we may have after this is over. And really, any of these are going to be dependent upon what the individual has experienced as trauma before the pandemic. So those people who've had an individual trauma or even a collective trauma before the pandemic are going to have a more heightened response to the trauma of the pandemic that we've experienced over the last 2 years. Also, people who've had a physical or emotional health, if they had some instability before the pandemic, that might be more difficult for them to cope with the pandemic and the trauma of that currently. So it also is dependent upon, your access to resources, your support systems, and whether or not you have access to financial stability. People who don't have those resources and that support and that financial stability are going to have a harder time dealing with the traumas within the pandemic. And those traumas could be like illness of self or of loved ones. There's such thing as called COVID Ptsd. So those are people who've been intubated or on a ventilator, coming out of the ICU, are developing some PTSD symptoms from that medical trauma. It could have been that you lost your job or your health insurance or your job changed very dramatically once the pandemic happened, and that could be experienced as a trauma. It also may be that you lived in a hotspot community where there were a lot of people dying at a high rate. That was one of the things that we struggled with in my community in Galax. There was also a lot of lack of stability and predictability within every area in Virginia throughout this pandemic when we were in the high numbers, especially towards the beginning. And then we all really struggled with virtual work, virtual school, quarantines, all these different changes in our day-to-day lives. And really with pandemic, we were when we were in the lockdown, we had a lot more access to social media and news and a lot of overexposure to information. It was very stressful to us and may have contributed to experiencing this as traumatic. Go to the next slide. So I wanted just to kind of share some information about COVID and depression. Some studies I've mentioned that some people who have had COVID, they had some PTSD symptoms after they were released from the hospital. Some people who've had COVID are developing a post-COVID depression. And one study found that like at least 50% of those discharged home after COVID-19 had difficulty with their cognitive skills. So that might be like where they were remembering to they place things, remembering conversations, what words to use in conversations. They were really struggling with some memory and concentration difficulties. Like a lot of people reported the brain fog that comes post-COVID too. So that's one piece of it, but then there's also another piece of depressive symptoms that has been really found post-COVID, and it's really not time dependent. So it seems like it's not something that happens right after you're released from the hospital from COVID, or you are getting over the COVID infection. It's really developing 3 months later after you think that you're out of the woods of COVID. People are developing more symptoms of depression at that point. And with that becomes a greater risk of suicide as well. So a lot of these studies are recommending that we continue doing universal screenings for depression and suicide risk, and also for practitioners to be more mindful of using some pharmacological antidepressants or other medications to treat that depression and prevent any long-term disability. What you can do if you do notice any depression post-COVID-19 infection, or even if you are feeling like you have post-COVID PTSD symptoms, really talking to your doctor about, or your therapist or psychiatrist about your symptoms. If you don't have an ongoing healthcare provider, seek care from an urgent care or call the member services phone number on the back of your insurance card, and they can help connect you with someone who is an in-person or on-call virtual provider that is covered by your insurance. It's also really important to consider both regular therapy and medications to treat your symptoms. When you look at depression or PTSD, you really want to put the combination of the two things together of therapy and medication management to get the most effective treatment for these, for both depression and PTSD. And again, if you're experiencing any thoughts of suicide, know this National Suicide Prevention Hotline. Call the SAMHSA's helpline where they can connect you with resources in your community. And then I think Stephanie put in the chat the information about community service boards and how to contact those as well. Virginia has community services boards across the state, so it's really important that you know about them, and each one has a variety of different services. It's good to know the resources within your own area's community service board, because it can be different ways of accessing. So we'll go to the next slide. And we're really going to talk more about the symptoms of PTSD. The effect of trauma can really be thought of as a normal response to an abnormal situation. So people who experience an abnormal or scary or shocking or dangerous or life-threatening situation can experience PTSD. It's usually happening 3 months after the event is when the diagnosis is going to happen. And this can be like a chronic diagnosis that affects the person's life ongoing, or it may be it is resolved within therapy and treatment. But the symptoms include flashbacks and dreams, intrusive memories. It's avoidance of thinking or talking about or reminders of the event. It's being easily startled, tense, having difficulty with sleep, more irritability or angry outburst, and then also having some difficulty remembering the event. Loss of pleasure can be one of, or feeling really numb can be part of PTSD. Excessive guilt or blame, having a negative view of yourself or others or the world. These traumatic events really shape the way that we see society, we see ourselves, we see the world into a very negative slant, because this event, and especially with the collective trauma of COVID, has really taught our brains that maybe the world and maybe our environment isn't as safe as we originally thought. And that can be very scary for our brains. So we have to really teach our brains again that the world can be a safe place. We can keep ourselves safe in a world that sometimes can be dangerous. And it is that we have the support and we have the tools to do that. So on the next slide, we're going to teach another coping skill, and this coping skill is called the butterfly hug. So this butterfly hug method was actually developed by an EMDR therapist, and EMDR stands for eye movement desensitization and reprocessing. And it is a self-administered practice that you can do anytime that you feel the need. She used it initially with survivors of Hurricane Pauline, which happened in Mexico in 1998, and it's kind of grown from there. So a lot of EMDR therapists will teach this technique to both children and adults, and it's helpful for everyone. So what you'll do is your eyes can be open or they can be closed. If they are open, make sure, again, looking at the tip of your nose. And what you'll do is you'll take your hands like this, and we're going to cross them over, and then we'll loop and hook our thumbs. So it kind of looks like a butterfly that I'm making on the screen, if you can see me. And then what you'll do is you'll put your hands over across your chest. So you have one hand touching each shoulder. And while you are breathing, and you can do the same breathing that we did earlier, where you're breathing in for 4, and then you're breathing out for 8. While you're doing that, you're just adding some slow taps on your shoulder. And you'll want to go really slowly, and you'll want to alternate the movement of the hands. So it's like one butterfly wing is tapping one shoulder, then the other butterfly wing taps the other shoulder. And you'll want to breathe very slowly and very deeply. If you'd like to add some more complexity, if you find that your brain is a little bit more active than you would like, you can also tap your feet at the same time. And what that's doing is giving your brain lots of different stimulation and things to focus on. So it's a little bit harder to focus on your thoughts. While you're breathing and you're tapping or you're moving your feet, you can notice if any thoughts or images or sounds or odors or feelings or physical sensations pop up. And you don't have to change them, don't have to push them away, don't have to judge them. If you feel that closing your eyes brings up too many things, if you're really feeling overwhelmed, then what you can do is you can look around the room and just look for different things that you see. You can challenge yourself to find 5 different things that you see around you while you're taking these deep breaths and while you're tapping your feet and tapping your butterfly wings on your shoulders. So when you're ready, you can go ahead and stop. And hopefully you're feeling a little bit more calmer. But again, this would be a technique that you would want to use if you're feeling like emotionally flooded or a little bit overwhelmed. So that way you're engaging a lot of different parts of your brain. So it's harder for your brain to think about the emotions. If it's looking for 5 things around the room, if you're doing the tapping with your hands and your feet, and you're also focusing on your breath at the same time, you're giving a lot of information. If you want to give your brain even more information, then you can then also add some music and earbuds or headphones and give it even a little bit more. I recommend like a meditation music, or if you like nature sounds, something like that, just to give it a little bit extra stimulation so you can focus on those other things and reduce the feelings of emotional flooding. So we'll go to the next slide. And really, we're going to talk about how we can mitigate the effects of trauma. So what we want to look at is when we are experiencing trauma or we have experienced trauma, we really need to focus on how we can create more safety in our lives, because that's where the healing happens. Healing happens in relationships that feel very safe, they build trust, they have transparency, and they have support from other people. So we have all of these prompts in the participant manual, so you don't have to feel pressured to put anything in the chat or write anything down right now, but you can use these questions to really go back and think and reflect on this. So what makes you feel or helps you to feel physically safe in life, and what helps you to feel emotionally safe? Because those things are very different. We might feel physically safe in something, but we might not feel emotionally safe where we feel supported or we feel like we can share our true feelings. And so kind of having an awareness of those differences can be helpful, because the more you feel physically safe and the more that you feel emotionally safe, that's going to be very healing if you've experienced trauma, like we've all experienced with this collective trauma of the pandemic. The next slide. We want to build trust and transparency with anyone who's experienced trauma. So we want to have to like really kind of think about like how we build small moments of trust in our relationships, because big like shows of trust or big things really doesn't build the trust that we really need. So if you think about your friendships over time, the people that you feel closest with, they were able to build trust with you over really small moments over time. It might have just been showing up on time. It can be starting meetings on time. It can be doing what you said you were going to do. That builds a lot of trust in relationships. And being transparent builds a lot of trust as well. So consider what you would need to feel more trust at work. Would it be that you need to make sure like or have a conversation about boundaries with a coworker? This might be saying like, when I share something with you, I really expect that you're not going to share it with somebody else, because that's not building trust with me. So if you want to build trust with someone, really making sure you have really good boundaries and you're respecting the other boundaries that they set for you too. Go to the next slide. So another way to mitigate the effects of trauma is through support. So you can have a whole list of people that support you and what support you really have in your life right now. The more support that you can build within your personal life and your work life, the better that you're going to feel, the better that you're going to be able to mitigate those effects of the trauma that you've experienced. So take some time to think about what you already have and what you may need that might be more helpful for you at work in building support or having support. Go to the next slide. Mitigating the effects of trauma includes having a voice and choice in collaboration. So voice is saying like you can speak your mind in a very respectful and healthy way, and you can share your ideas, and those people who are hearing them are also listening, and that you feel heard. And that is very healing when you've experienced trauma. And then having a choice in things. When you are offered choices, we all feel better. No one, our children, ourselves, like no one likes to be told what to do. We all like choices, and it doesn't feel good to have someone making those choices for you. So having that voice and choice and collaboration really makes a difference in how we experience environments, whether at work or in our personal life. We really want to make sure that we're being mindful of how we can foster that voice, choice, and collaboration, especially if you're a leader in your community or your agency or your volunteer work. This is incredibly important, and the people that you're leading will definitely feel more validated and supported by you as a leader. Go to the next slide. We want to take into consideration the intersections of culture and history and gender. So really kind of thinking of everyone, including yourself, as a whole person. We all have our own histories, we have our own cultures, we have our own gender, we have our own race, we have our own so many different things that are a factor. And we really have to kind of take those in consideration for ourselves. How has my, history been? Do I have any intergenerational trauma that's been passed down to me, or historical trauma that my family has experienced that still affects me today? I think those are really good things to ask ourselves. That way we have that awareness, because if we ignore those things, then we might unintentionally have like a triggering event and not really understand where that's coming from, or those feelings that might be out of anger or resentment or hurt. We're not really sure where they're coming from if we don't take a look at these things. But then also making sure that you're looking at how does it affect your work? How does it affect your work in the community, or at your organization, or in your volunteer work? Having a really good understanding of ourselves is very important. That way we can understand and be open to understanding others more deeply and better. Go to the next slide. We're going to turn it to any questions. So we are almost done wrapping up. So we've got 8 more minutes until 11 o'clock. So you are welcome to put any questions for any of us in the chat, and we'll, depending on whose section it is, we can answer your questions. Oh, I see one question about the demonstrate the butterfly hug, and I did it a little bit earlier. I don't know if you can see me. There might be a way to change your layout on your screen. And so I have my layout, so I can see the video at the top. So it might be hard to see me if you just have your the format just on the PowerPoint presentation. But if you can change your format real quick, I can show you real quick, or we can put a link. I think I've got some links in the to like a video on how to do this. So that's another option that we can do. All right, you changed the format. Great. So you can see me now. Thank you. So what you'll do is you'll take your hands like this, and then we're going to cross them over and flip them over so my my palms are facing me, and then we're going to hook our fingers like this to create like a butterfly, and then we'll put it like this on our chest, and then I'm just going to tap slowly on each shoulder. You don't have to hook your hands. That's just something that we like to do because I mean it's a much more fun to say it's a butterfly hug than just to say that we're going to tap each shoulder. So you would just do that for as long as you feel the need to, and just very slowly and alternating each hand. And it's very simple. And you can add music, like I said, or tap your feet in addition, but it's something that you can add to your deep breathing exercises.
Okay. So for those who are still here, we do have an evaluation. And I'm going to ask that Regina also put the link to the evaluation in the chat box. There's also a QR code. You can take your phone or your smart device with the camera and put it up to the QR code, and it will take you directly to the evaluation. We really appreciate your response from today's webinar.